Hi, my name is Katie Wilson, and I'm an occupational therapy student at College of St. Mary in Omaha, Nebraska. For my Introduction to Pathophysiology video presentation, I will be talking about stress and the relationship with the disease insomnia. As a college student and during midterms week, the prevalence of insomnia is higher than normal, at least for me that is. Before we begin discussing the correlation, let's first learn what stress is. Stress is the effects created within an organism by the application of a stressor. A good example of this would be midterms or finals week and the pressure we feel as students to succeed in our classes. Walter Buchanan used the terms stress in both physiological and psychological sense in 1914. Because of the context of this course, we will be relating more to the physiological concept of stress. This can be defined as a chemical or physical disturbance produced by a change either in the external environment or within the body itself that elicits a response to counteract the disturbance. According to our textbook, insomnia is the inability to fall or stay asleep and may be rated as mild, moderate, or severe. Acute insomnia refers to the periods of insomnia that are brief and sporadic. This type of insomnia is caused by illness, emotional or physical discomfort, sleep schedule interruptions, so like traveling, so you have jet lag from different time zones, or even can be from switching to day and night shifts, and everyday life stress. Examples of everyday life stress are a job loss, marriage, divorce, or even moving. To be diagnosed with chronic insomnia, it needs to be more than 3 weeks long. Causes of chronic insomnia include underlying psychological disorders like depression and anxiety, or even chronic stress. Insomnia is the result of our central nervous system being targeted. Our central nervous system consists of the brain and spinal cord. The image on the slide is a good illustration of the CNS and the parts of the brain. This is the stress response diagram, and I think it's a good illustration of it. It's the APA axis, the hypothalamic pituitary adrenal axis, is the pathway that describes the stress response. The hypothalamus in your brain secretes corticotropin-releasing hormone, which will then bind to its specific receptors on the pituitary gland, particularly the anterior one in this. This stimulates the anterior pituitary to release adrenocorticotropic hormone. The hormone is then transported through the blood to the adrenal gland, which is located on top of our kidneys. After ACTH bind to the adrenal glands, cortisol is released. Cortisol acts on our body's metabolic functions, and it has been shown that people who suffer from insomnia have elevated levels of cortisol in our bloodstream. There are many signs and symptoms indicating insomnia, which include an overall tiredness, falling asleep during the day with trouble falling asleep at night, irritability, problems with concentration and memory, and headaches. An individual should go and see a doctor when daily functions are starting to become difficult because of a lack of sleep. These two pictures on the slide are different ways that the body reacts to insomnia and insufficient sleeping. I particularly like the psychological picture that shows the lower performance, slow to reaction time, risk of depression, and risk of anxiety disorder, because I'm also in an abnormal psychology class and we have been talking about insomnia. Treatments for insomnia include over-the-counter sleeping aids, prescription medications, and cognitive behavioral therapy. CBT is used to help you rid of any negative thoughts and worries about insomnia that keep you awake at night. This is generally the first line of treatment. Eliminating the stress that keeps you awake can also help. So that would kind of be like trying to train yourself going to bed with happy thoughts. And I've also read that even eating right before you go to bed can help contribute to lack of falling asleep at night and staying asleep. So I have quick prepared a 5-question quiz to help reinforce insomnia. So I'll give you some time in between the questions to help you answer them. So the first one, what is insomnia? Is it A, sleeping past your alarm clock, B, the inability to fall asleep or stay asleep, or C, waking up due to nightmares? Number 2, What part of the body is targeted for insomnia? Is it A, the muscles, B, the central nervous system, C, the sympathetic nervous system? Number 3, when is chronic insomnia diagnosed? Is it A, after 1 week, B, after 3 weeks, or C, after 1 day? Number 4, where are the adrenal glands located? A, the brain, B, the stomach, or C, on top of the kidneys? And number 5, what is the first line of treatment for insomnia? Is it A, meditation and yoga, B, CBT or cognitive behavioral treatment, or C, sleeping pills? All right, so if you answered B for number 1, you are correct. The correct answer for number 2 is B, the central nervous system. Number 3 is also B, after 3 weeks. 4 is C, on top of the kidneys. And 5 is B, CBT treatment is the first line of treatment for insomniacs. So I really liked this picture and quote about my insomnia wouldn't be so bad if I didn't lie awake worrying about it, because I think that is a contributing cause to it. I think we overthink everything when we're in bed about our day and our and what like the week's gonna be like. So that I think that can cause kind of a little bit of stress to keep you up at night. And so my overall message is, so the next time we as students feel like we need to stay up and cram for that exam to get that A, we should remember how important maintaining a sleep schedule is, and also because that will help with our concentration and memory when it comes to taking our tests. So thank you for watching my video presentation on insomnia, and I hope you have a good day.